Flying while pregnant. What airlines won't tell you. Is it really safe to board a plane while you're pregnant? Some say it's no big deal, just buckle up and go. Others warn it's risky, stressful, and potentially dangerous. But here's the truth. While flying during pregnancy can be perfectly safe, there's a long list of hidden risks, airline policies, and unexpected complications that many women never find out about until it's too late. Like from surprising airline restrictions to the one insurance mistake that could cost thousands. This isn't just about comfort. It's about being prepared, protected, and fully aware of what's really going on at 35,000 feet. So before you book that next trip or take off with a baby on board, here's what every pregnant traveler needs to know, and what airlines and travel blogs rarely explain. Number 1, the perfect time to fly while pregnant. Timing is everything, and when you're pregnant, it can make or break your flight. So what's the best window to travel? Doctors and seasoned moms agree. The second trimester, weeks 14 to 27, is your sweet spot. Why? Because by then, the morning sickness that hit you in the first few months has likely passed. Your energy's returning, and your belly, still small enough to move comfortably through airport terminals and squeeze into airplane seats without feeling like you're in a wrestling match with the tray table. But don't wait too long. Once you hit the third trimester, everything changes. Your bump grows, your center of gravity shifts, and every step becomes a little slower. Not exactly ideal when you're racing to gate 32 in a crowded terminal. Plus, airlines start tightening the rules. Some won't even let you board past 36 weeks without a doctor's note, or at all. Still thinking of flying in your first trimester? It's possible, but brace yourself. That's when fatigue, nausea, and hormone chaos are at their peak. For many women, even a short flight feels endless during that stage, so if you can choose the middle. It's the calmest chapter in the pregnancy journey, and your body will thank you for it. But just because it's the right time doesn't mean you're cleared for takeoff. Number 2, airline rules and fine print you can't ignore. So you've booked your flight, bags are packed, but here's where many expecting mothers get blindsided. Airline policies aren't as flexible as you think. Most carriers discourage flying after 36 weeks, and some flat out refuse to let you board without proper medical documentation. But here's the catch. Those policies aren't the same across airlines. Some may require a doctor's note starting at week 28, verifying your due date and confirming you're not at risk for complications. Others might allow travel a little later, but only on certain routes or with additional waivers. And if you're flying internationally, the rules get even stricter. You could be denied boarding at the airport gate if you don't have the right paperwork. And yes, it happens more often than you'd think. Then there's the fine print most people skip. If you go into labor mid-flight or require medical assistance, who's responsible? Many airlines quietly include disclaimers that limit their liability, especially in the third trimester. That means delays, diversions, or emergencies. You might be on your own. And while most crew members are trained in basic first aid, very few are prepared for an in-flight delivery, which turns your airborne adventure into a high-stakes medical emergency at 500 miles per hour. But navigating airline rules is only half the battle. What if your insurance doesn't have your back either? Let's talk about that next. Number 3, insurance traps and why you might be on your own. You've booked your flight, got your itinerary, and maybe even splurged on extra leg room. But there's one thing many pregnant travelers completely overlook, and it's the one thing that can matter most in an emergency: insurance. Most travelers assume their health insurance will cover them no matter where they go, but here's the catch. Many plans don't cover pregnancy-related complications outside your home country. That includes early labor, emergency care, or a sudden need for prenatal treatment abroad. If something goes wrong mid-trip, you could be left footing the entire bill, and the costs can skyrocket fast. Even more shocking, delivering a baby overseas without proper insurance can cost tens of thousands of dollars out of pocket. And if you're thinking you'll just hop on a plane and fly home in an emergency, think again. Medical evacuations aren't just rare. They're often not covered under basic plans and can cost as much as a luxury car. That's why travel-savvy moms-to-be always ask 2 questions before flying. 1, What exactly does my insurance cover if I need help abroad? 2. Do I need supplemental or evacuation coverage just in case? And if you're flying internationally, especially late into your second trimester, that answer is almost always yes. But that wasn't the only risk lurking just beneath the surface. Like, number 4 before you board, medical green light and essentials. You wouldn't fly with a faulty engine, so why risk it without medical clearance? Before you even think about packing your bags, make your first stop your doctor's office. Not just for peace of mind, but because what you don't know could affect you midair. First, let your doctor know every detail, where you're going, how long the flight is, and whether it's domestic or international. Why? Because the length and nature of the trip can completely change what kind of preparation you need. If you have any underlying health issues, asthma, high blood pressure, diabetes, your doctor might suggest specific precautions. But even if your pregnancy has been smooth, they'll likely bring up a few things you haven't considered. Decompression stockings. No, they're not glamorous, but they help prevent dangerous blood clots and improve circulation on long flights. Most OBs will recommend them, especially if you're flying longer than 4 hours. Motion sickness remedies. If you're prone to nausea, and let's face it, most expectant moms are at some point, this is crucial. Some go for doctor-approved meds, while others prefer acupressure bands. They're not backed by science, but they help enough people that they're worth packing. Diarrhea and gas medication. Uncomfortable topic, maybe, but totally relevant. At high altitudes, gas expands, and if you've eaten the wrong thing pre-flight, the bloating can be miserable. Plus, if you're flying internationally, food and water abroad can lead to digestive issues, and diarrhea during pregnancy can become dangerous fast. Prenatal care abroad, going on a long trip, you may need to plan for a checkup at your destination. That means finding a local OB/GYN ahead of time. In some cases, your doctor might even be able to refer you to someone they trust. Destination hospitals, let's hope you never need them, but knowing the name of a reputable hospital or clinic nearby is just smart travel planning. Emergencies happen, and when you're pregnant, the stakes are higher. Flu shot. Traveling during flu season, your immune system is already working overtime. Many doctors will suggest getting vaccinated before you fly, especially if you're headed to a crowded airport or a country with lower sanitation standards. Number 5, in-flight tips no one mentions. So you've made it to the airport, cleared security, and you're finally in your seat. But here's where most pregnant travelers let their guard down, and that's a mistake. Flying isn't just about getting from point A to point B. When you're pregnant, it's about protecting your body in a very unnatural environment. Low air pressure, recycled air, limited space, and long hours of sitting. First, skip the broccoli. No, really, foods like cabbage, beans, broccoli, or anything carbonated can expand in your stomach due to cabin pressure and leave you feeling bloated, gassy, and miserable. A simple meal change before your flight can make a world of difference. Next, a seatbelt. Safety isn't just about strapping in. Make sure your seatbelt is low across your hips, under your belly, never across it. In turbulence, this positioning reduces pressure and keeps you and your baby safer. Hydration, crucial. The dry cabin air already sucks the moisture out of you, but when you're pregnant, dehydration can reduce blood flow to the uterus, which you don't want. Sip water throughout the flight, even if it means more trips to the bathroom. Speaking of moving, you need to walk. Even on short flights, doctors recommend standing and walking every 30 minutes if it's safe to do so. Why? Because sitting too long increases your risk of blood clots. If you can't walk, at least flex and point your toes regularly to improve circulation. And where you sit matters. Choose an aisle seat, easier access to walk and reach the bathroom. A bulkhead seat gives more space, but if turbulence is your enemy, go for a seat over the wing. That's the plane's center of gravity, which usually gives the smoothest ride. It might seem like small stuff, but in-flight habits, can make the difference between a smooth journey and one that becomes dangerously uncomfortable. Number 6, international flight warnings when flying could be too risky. Flying internationally while pregnant sounds exciting, new places, new memories, but for some women, it's a risk that simply isn't worth taking. If you're in your first pregnancy and either under 15 or over 35 years old, flying overseas is often discouraged. Carrying twins or multiples? That's another red flag. Placenta problems, vaginal bleeding, or any history of miscarriage or premature labor, doctors will likely say, don't fly. And it gets stricter. Some destinations require live virus vaccines, which pregnant women can't get safely. Traveling to areas with serious disease outbreaks, that's a no-go too. Plus, if your trip involves reaching high altitudes above 12,000 feet, your doctor will almost certainly advise against it. The bottom line, international travel during pregnancy isn't just about booking a plane ticket, it's about understanding the hidden dangers your doctor is watching out for and knowing exactly when you should hit pause on those travel plans. But that's just the start. The rules for domestic flights and insurance policies aren't always much simpler. Flying while pregnant doesn't have to be a gamble. With the right knowledge, preparation, and a trusted doctor by your side, it can be a safe and even smooth experience. But it's clear there's more beneath the surface than what most airlines or travel sites tell you. So, next time you're planning that trip, don't just book and hope for the best. Check the rules, get your medical green light, and prepare for every twist and turn. Because when it comes to your health and your babies, being informed is the best way to survive and thrive. Thanks for watching Airport Survival Guide. If you found this helpful, hit subscribe and turn on notifications for more insider tips that keep you safe above the clouds. Safe travels, and see you on the next flight.